Good morning, our viewers. My name is Charity Namara. I'm the moderator for today's session for Gallup Initiative Uganda. The session is on sexual reproductive health. And with me is a group of eminent members of society. All these are very engaging personalities in our communities, especially in Kampala, who have engaged young people in different forums on sexual reproductive health. But first of all, we need just to know what we mean by sexual reproductive health. And we'll take the definition of World Health Organization, which looks at sexual reproductive health as the right of all to make decisions concerning their reproduction, free from discrimination, coercion, and violence. So that's definitely is something that is important to all of us, and that's why today morning we have a group of these gentlemen and ladies, and I'll give them a chance to introduce themselves so that we can start, because they have a lot to share with us.
Thank you very much, our moderator Charity. I'm Salongo Kamogamwavu Takwana. I'm a male change agent in my community, and I'm also a local leader.
Yes, well, good morning, dear viewers. I am Reverend Nathan MUGALU. I am a clergy working with the Church of Uganda and also a counseling psychologist by profession. I'm glad to be part of this panel.
And by the name is Mdondo Sharon, a female change agent from Gallup Initiative Uganda. I'm very glad that I've been invited here to talk about sexual reproductive health, which is more of a right of all people to make decisions. I'm so privileged to have this opportunity. Thank you, Madam Moderator Charity. I'm here to discuss about it.
Thank you so much, Madam Moderator Charity. Good morning, viewers. I'm by the names of OKUNYA Andrew.
Thank you, gentlemen and lady, for that powerful introduction. I will delve right into the questions for this session. And I'll start with Mr. Kamoga. Do religious and local leaders influence sexuality education? What is your take? If yes, why and how? Talk to us, Mr. Kamoga.
Thank you very much, Madam Moderator, Miss Charity. You asked whether we influence the reproductive health among young people with the religious leaders and the local leaders. The answer is yes, we do. Why? First and foremost, we, the local leaders and religious leaders, we are very close to the young people in our community, in that whenever they get problems, they rush to us to find a solution. And secondly, we are role models in our communities. Whatever we do, we are exemplary to the young people. Thirdly, we are very near to the young people, in that whenever sometimes the parents are very busy, they don't attend to their children. So these people, when they are like now the community, we tend to be very near to them. So I think those are some of the reasons why I can say that it's very crucial for us to influence it. You also asked that how do we influence it? First and foremost, being role models in the community, we sensitize the young people. I understand that when the reverend is preaching, he can talk about sexual reproductive health and in a positive way that young people can understand it. Secondly, we conduct mediations every day, and then the parents get misunderstandings with their children. So we intervene as local leaders and religious leaders to do mediations. We also refer some issues. They get issues like defilement, rape, early marriage. So in such issues, we refer them to places where they can get assistance from. In addition to that, we also mobilize the community in case of any other reproductive health service, like HIV counseling and testing and the like. So that's what I can submit as of now. Thank you very much, Madam Moderator. Salon Kamoga Mwavu Takwana.
Thank you, Mr. Kamoga. I like your third name. It's very unique. And the issues that you advance are very important about your role in terms of how you influence sexual reproductive health among the young people, how you do it, why you do it, the proximity, the fact that you're role models and all. Those are things that young people really crave to be part of. I'll go to our Reverend Nathan MUGALU. Yeah, Reverend Nathan, we've had a lot of, we have had some religious leaders commenting that some of these things are around sexual reproductive health shouldn't be talked about, because by us talking about them, we are probably inspiring the young people to start engaging in maybe early engagement, sexual engagements. But do you think that by avoiding that talk about sexual reproductive health, does it mean that the youth are making right sexual reproductive health choices? What is your take, Mr. Nathan?
Well, I'm so delighted to be part of this discussion. A very important topic, a very important subject about sexual reproductive health. Dear moderator, that question is an instigating question, because as leaders, especially religious leaders, God has called us to take care of the person as a whole. When you look at society today, where family systems are breaking, where cultural values are breaking, where we are being faced by a lot of misconceptions about sexual reproductive health, where we are being faced with a lot of myths, wrong information, where people no longer care, where kind of morals and values and skills are deteriorating in society, it is our role as religious leaders to talk about sexual reproductive health such that our youth can make the right decisions and also be able to navigate through life as balanced youth. Number one, if we keep quiet, yet the youth are in a stage of making key decisions about their future, we shall be neglecting our role as religious leaders of influencing society. Then the other issue we can talk about, these youth are going through a lot of changes on their bodies. They're going through what we call hormonal changes. They are going through a lot of peer influence. Now, if we keep quiet about SRH, how are we going to raise these youth? So it is important that as religious leaders, and all stakeholders, actually address key issues of sexual reproductive health, all of us in our own capacities, if we are to help these young people. If we keep quiet, they are going to make wrong choices. That is why of late we see a lot of many young people are making wrong SRH choices. So many youth are getting pregnant because they lack information. So many young people are engaging in dangerous relationships because they lack information. So many young people have not been able to conduct themselves as expected simply because they have an information gap. And that information gap is from us, the leaders that have been entrusted with this responsibility. Therefore, all religious leaders watching me, all cultural leaders watching me, all opinion leaders, all stakeholders, it is our role to talk about SRH. It is a reality that we should live with. It is our role to talk about sex and sexuality. It is our role to talk about life skills. It is our role to talk about decision making. It is our role to explore the different family planning and contraceptive options available. It is our role to talk about the structural hindrances towards access to SRH services and quality SRH services. It is our role as religious leaders to do advocacy, to set up youth-friendly services, adolescent-friendly services, where adolescents can go and access SRH services, where they can access information. It is our role as religious leaders to bring up information, to put it down to the young people, such that they can understand it in their local languages, such that they can understand it in simple terms. But also don't forget that it is our role also to talk to these youth, but also talk to their families, such that at the end of the day, they can make the right decisions. Right decisions are a function of right information. Unless religious leaders, local leaders, unless we exploit the very vital role we play in society, the vital role we play in influencing attitude, the vital role we play in influencing actually the capacity to think and make decisions and also make a future, then our youth may be able to make wrong choices and that may backfire on us. So that is a very key view, that is a function that we should not ignore. Giving information, talking about SRH, referring our youth to SRH centers, and also being examples ourselves. Thank you very much.
Thank you very much, Reverend MUGALU. Those are very, very bold commitments from the religious leaders. One thing I pick from this discussion, our dear viewers, is that right decisions are a function of right information, just as asserted by Reverend MUGALU. And also, the evil thrives due to the silence of good people, good men and women. So it's the role of all of us to talk about sexual reproductive health with young people, and to break the intergenerational silence that will brew suicidal tendencies, just like Reverend MUGALU mentioned. We'll move on to our next panelist, Andrew. Andrew, what have you done as a leader to ensure that the youth in your community have accurate information about sexual reproductive health? Speak to us, talk to us about that.
Thank you very much, Madam Moderator. Once again, by the names I'm OKUNYA Andrew, the Male Changing Agent, GALAP Initiative. During the Genesis or the Exodus, when Moses was moving to the promised land, God told him, "Go and lead my people." So we leaders, we are not born to rule, but to lead our fellow humans. Why am I bringing such information? We are supposed to inseminate information to people, not in a forceful way, but in a calm way. Okay? So, when you're inseminating the information to the youth, you make sure that you take them in a calm way. Because when you force into information to somebody, that means you will not give that person the rightful information. Right? But when you bring that person closer to you, that means you will give that person the rightful information and that person will listen to you. Secondly, edutainment. When you bring a certain project, if you want to make them to understand what the project is, bring the edutainment. Let them get involved. The youth themselves, let them get involved in such a program. You may say, if I can say teenage pregnancy, make an edutainment, a drama that contains about the teenage pregnancy. Because when you make, it brings them to understand much easier. Because when somebody gets involved himself into the drama, he or she can understand the gist of matter. Third, breaking the information in different local languages. There is actually Ateso, the Baganda, since this is a city, there is a mixture of different languages. But how do you bring that information to that person who doesn't understand Luganda, who doesn't understand Chinyankole, who doesn't understand Lusoga? So bring that information using different local languages in a simple term. Somebody can understand it so well.
Very insightful comments from Andrew. Very insightful. It just got me reflecting, what have I done during this COVID-19 to pass on sexual reproductive health to the young people that I stay with, to the youth, and to the people that are supposed to access and have this information disseminated to them. I'm always talking to young people in English, but do they actually understand the information in English that I give them? Mr. Andrew says that we need to translate that information into simple guides and also into the different languages so that it's easily utilized and absorbed. All right, we go to Sharon, Miss Sharon Mudondo, the only lady on the panel. How exciting. Sharon, I know that you have done a lot of work with the Nietu Youth Program with GALAP Initiative Uganda. You've done an amazing work in terms of engaging young people, engaging also parents, by virtue of you being a leader in the community. Talk to us about the challenges that you have faced while imparting sexuality education in your community.
Thank you so much for that question. We as female change agents, we've faced a lot of challenges to address this issue of sexual reproductive health. Since it is a right of all to make a decision, it's very hard to make a decision for someone. But to my extent as a mother, I'm a mother, though I'm a female change agent, but I work as a mother. Because I know we mothers, it's not just giving birth and you leave. You have to help your child grow. So in the process of helping your child to grow, you have to help your child to make the right choice. But these are some of the challenges we are facing. Some mothers are very irresponsible. After giving birth, they give their children to the maids. So they leave the maids to be there to be the mentors of their children. So in this case, if the so-called mentor, the maid, was not like sensitized before, just know what your child is going to be. The maid will help your child to make bad decisions or good decisions, but in most of the cases, you find that a maid will give like false information to your babies or to your youth. For example, the words they use. We as mothers, do we mind what our children are hearing, our youths are hearing? What are they watching in your absentia as you are at the place of work? What are they watching at home? What are they doing with the maid? What's the maid teaching them? We have another challenge of the nature of jobs. The mothers, the fathers of this nation, we've turned to be too busy. We are too busy to our children. We've decided to take the other side of the job to be at the higher extreme, and we left out this part of nurturing our babies, nurturing our youth. We leave them to the world. We leave the future to nurture them. We leave the world to teach them what to do. So in that case, we find that our children are making bad choices of having bad friends, bad companies, and in the end, they don't have a right of making the good choice at the end. Then we have another issue of language. Most of the sexual reproductive health information is in English. They use English, and some parents are illiterate. So it is very hard for the parents to translate or to read this information and pass it to their children. For example, you find the charts, like we are in COVID-19 something, but most of the information about COVID-19 is in English. Most of the information is in English. So it's very hard for these illiterate parents to transfer that information to pass on that information to their youths. So it is a very big challenge. Then we have another issue of ignorance. Some of the parents don't know what to do. My child has been raped. What next? What can I do? And some of them, they even fear. If the dad has like had sex with the daughter, where can I report to the dad? Where can I go to? Who can talk to the dad? Some parents are scared of reporting, coming out to report. They're ignorant. Where can I run to? And we have a challenge as Ugandans. We have very few teenage centers in Uganda. For example, in the whole district of Kampala, you may find that we have Naguru Teenage Center, and also Kawala. We have very few teenage centers in Uganda as a whole. So it's very hard for somebody to come from Kawempe, coming to Naguru, from Nsambya, Lubaga, coming to Naguru. It's very far. Just look at that distance. And this ignorance is a very big challenge as we, the female agents, female change agents, we have that challenge of ignorance. Then we have another issue of attitude. Some people have bad attitude. When you talk about just the word sex, the person will just know that you've brought ill information to the family. So some will even tell you, go, disappear, leave my family, mind your business, because of some attitude. So I know, and I know with bad attitudes, you have a negative perspective. Some people have a negative perspective about sexual reproductive health. They think it deals with only sex period. They know that it helps the child to do a right choice. So in other words, as I conclude my discussion, I'll just say that please, parents, have time, spare time for your kids to help them do a right choice, to choose the best friends, good companies, and good future for them. May God bless you.
Very crystal clear message from Sharon. We have to create time for our children, time for our spouses, time. Probably, who knows, this COVID time was a time that was meant for us as a family to come together and to be able to shape the narrative around families bonding and having children that believe in their parents and get access to information. Sharon, I'll ask you something else this time, because you said very well that you're a mother, and when you're doing your work, you're doing it as a mother, which is really touching and inspiring. Most of us do work because we are paid to do work, yeah? You're paid a salary or a wage, and you just do the work and leave it at that. As a parent, yeah, in your community and in your household, what role have you played in imparting sexuality education among young people? Can you talk to us about that?
Thank you so much. As a parent, stroke a mother, this is how I've tried to help the youth around me. First of all, I've gone ahead to get the information about sexual reproductive health. What is sexual reproductive health? Because it is very acidic to talk about something that you don't understand. So through GUIU initiative, we've had very many workshops, and those workshops have helped me to understand what is sexual reproductive health. So through that, I've taken up a step of visiting the youth in different schools. We discuss about their issues. I've given them time. There is a component that I've realized in this sexual reproductive health of giving the youth time. You listen to them. They love to be listened to. Whenever you listen to the youth will always open up. And whenever they open up, you discuss a lot and you discover a lot about them. Through the discovery, that's where you get the solution. What are the challenges? What are they facing? How do you go about it? Because you cannot just address an issue without understanding it. So you first have to understand it as a parent. What is it all about? How am I going to help such and such an issue? How will I help my babies? How will I help these youth to go about with their future, to make the right decision? How do they call their friends? How are these so-called good friends? Are they real good? What are the qualities of a good friend? How do you make your decision as a youth? Is your decision taking you somewhere? Or is your decision taking you anywhere? Or is your decision going to destroy your future? So I, as a female change agent, through GUIU initiative, I've tried to help the youth by listening.
Thank you so much, my panelists and our viewers. I hope the message is clear, crystal clear. I cannot really overemphasize anything, because everything is in black and white. We have a role to play. That's what I can say. And we want to extend special appreciation to GUIU Initiative and Plan International Uganda through the Niyetu Youth Program that has really done a lot of work with changing the attitudes of young people around sexual reproductive health, engaging different structures, but most importantly, working with change agents, both male change agents and female change agents in the district of Kampala, in all the divisions, to demonstrate that actually change happens when leaders come together, when leaders speak to issues of importance, such as sexual reproductive health. And the onus is on all of us, young people and also actors, to engage and make a movement of champions of sexual reproductive health, where access to information is as easy as walking into a restaurant and eating. Access to youth corners is very easy. Referrals are very fluid. So all I can say is that we all have a responsibility, and we just need to take action and be the change that we want the world to see. And from all of us, thank you very much, and all the best.